All right, good afternoon and welcome to Onslow Memorial Hospital's live event on Breast Cancer Awareness Month and breast cancer screenings. While we wait for some people to join, I'm going to let Dr. Spencer and Dr. Holland-Ellis introduce themselves.
Perfect. So glad to be back to another Facebook Live. We've been spending a lot of time talking about COVID, which is, of course, very important and still continues to be a huge issue in our region and the nation. But we did want to turn a little bit towards breast cancer. As you know, it's Breast Cancer Awareness Month. And it's really important that while we're still tackling COVID and making sure we're keeping our community safe from that standpoint, we're also paying attention to those other health issues that are really important to prevent and treat appropriately. So I am Dr. Steve Spencer. I am the Chief Medical Officer for Onslow Memorial Hospital. I've been here for about 7 months, enjoying my time learning the region and doing these Facebook Lives. And we have Dr. Holland, who will introduce herself.
Hi, I'm Dr. Sequia Holland-Ellis. I am a family medicine physician at Onslow Internal Medicine and Primary Care Clinic.
All right, so we're going to go ahead and get started. Good afternoon. On behalf of Onslow Memorial Hospital, we want to welcome you to our Facebook Live event for Breast Cancer Awareness Month. Thank you to Dr. Burlingame Deal and the Onslow Memorial Hospital executive team for sponsoring this event. And we're grateful to each of you for joining us today as members of our community. Our speakers today are Onslow Memorial Hospital's Chief Medical Officer, Dr. Stephen Spencer, and Onslow Internal Medicine and Primary Care's Dr. Holland-Ellis. Feel free to leave any questions in the comment section, and we'll take time at the end of the event to answer as many as we can. At this time, I'd like to hand it over to Dr. Stephen Spencer and Dr. Holland.
Great, thank you. So thank you, Dr. Holland, for agreeing to do this. First question is really, what brought you to Onslow? How did you get here?
So I was actually in the Navy. I spent 9 years in the Navy, and one of my tours I came up to Camp Lejeune, and I really liked the area. So I told my husband that once I got out of the Navy, that I would like to come back to this area, and so that's how I ended up at Oslo.
Perfect, perfect. And can you tell us about your interest in women's health?
So it actually goes back to medical school. I wanted to do OBGYN and I actually became an OBGYN intern for the Navy. But I didn't really like the surgical part. I really liked women's health and I liked, being in clinic and doing clinic procedures, also with labor and delivery. So I found another way to be able to do that, and that's through family medicine. In the Navy, I got the chance to do deliveries, which is another thing that I really like to do. But I also got to focus my practice a little bit more when I got out of the Navy to be more specific for women.
Perfect. So that brings us to our topic today about Breast Cancer Awareness Month. And can you just give us a quick update on the breast cancer screening guidelines? This is something that lots of women become familiar with, but there's been, I think, a little bit of confusion over the past few years about exactly who should be screened.
So the screening guidelines actually depends on which screening program you go with. So the USPSTF, which is the screening guidelines that I usually go with, will recommend between ages 40 and 49. We actually have a sit down with the patients and we do some shared clinical decision making where we decide if this is really a good thing, if the risk of the breast cancer screening is going to be more than the benefits from it, and we make decisions based on that accordingly. But I think all of the guidelines pretty much agree that 50 is when we start doing screening. Now, based on whichever guideline, it will be either 1 year, every 1 year, or every 1 to 2 years. So the USPSTF actually recommends every 1 to 2 years, but the American Cancer Society actually recommends once yearly at age 50, and those guidelines go through age 74.
Okay. And that brings me to my next question. So, are there folks who are at increased risk of breast cancer, and does that change the guidelines for screening?
Yes, there are people who are at increased risk for breast cancer. One of the biggest risks is family history. So we say if you have one first degree relative with breast cancer, and a first degree relative is mom, dad, brother, sister, or children, or two second degree relatives. So that could be grandma, grandpa, aunts, uncles, cousins. If you have those, then we would definitely recommend you getting screened sooner. And then if you have a male relative that had breast cancer, because that's a pretty rare phenomenon, then we certainly recommend you get screened. And we usually use the guideline that if the patient was diagnosed, say, at 45, then you should definitely start screening 10 years prior to that diagnosis. So then you would start screening at 35, although the guidelines say 40 for everybody, or 50 for everybody, 40 shared clinical decision making.
And when you say screening, what are you referring to? Tell me about that screening process.
So mammography is what we're really referring to. So we will send patients to have mammograms done, where they're actually just taking a look at the breast and see if there are any abnormal pockets of tissue, if there are any abnormal lymph nodes, anything that looks suspicious. So we send them to get that done, and then based on that, then we go, to further evaluation, or we say, yeah, everything looks good. Come back next year or 2 years, depending.
And what should women be doing on their own? Is there anything they should do at home or be looking out for in terms of breast cancer
Well, I
awareness?
think one of the things is that you should just be very familiar with yourself. When you go to your doctor sees you once a year for this exam. The mammography sees you once a year, or like I said, every 2 years, depending. So you should be very familiar with what's normal for you. So if you feel anything abnormal, it's very important that you go to your doctor and you say, hey, something's not right.
Are there any particular ethnic or minority groups that are more at risk for breast cancer?
Actually, in this country, white women have a higher risk of breast cancer. However, Black and Latino women usually will present with more aggressive cancers or more advanced cancers at the time of diagnosis. So again, it's very important that every woman, makes sure that they get these done.
And is there a group that is often worried? We call them the worried well, but we probably don't need to be as aggressive in screening them. What groups of women would you say you probably don't need to be as worried about?
Well, definitely if they're over 75, we say, typically we don't need to be screening those patients, the younger patients. And so, we get the patients who come in who have fibrocystic breast disease, or they've had a history of a fibroadenoma. And yes, those things can increase your risk later on. But generally, we typically don't see those types of cancers in our younger patients. Now, I'm not saying that they can't get them. So if there's anything concerning, they should come in. But a lot of women, will come in for these concerns, and sometimes just reassurance is good for them. But if there's any clinical suspicion, then we, move forward with mammography or ultrasounds. If they're younger, we typically go with ultrasounds.
Right. So it sounds like those general screening guidelines, maybe 40 to 50, and then certainly 50 to 75 are there. And then be outside of that, it's sort of a conversation based on any clinical symptoms, any family history, those sorts of things may guide you
Right.
for screening, but they fall out of those general screening guidelines.
Right, and we have to remember that screening guidelines are just that, they're guidelines, so
Mhm.
they're not, written in stone. So if you have any suspicion, no matter how old the patient is or how young the patient is, you go for it with the screening, you go for it with the testing, and make sure that you get this patient taken care of.
Right. So patient has some sort of abnormality that we find on the mammogram. What's the next step for that patient?
So actually, it depends on what the abnormality was. So we have these screening guidelines, actually a classification system with radiology. It's called the BI-RAD system. So it kind of helps us grade these suspicious findings or these abnormalities on mammogram. And then based on that, then we would go forward with what it would be recommended. So for instance, a BI-RADS 2 is actually benign. So typically, BI-RADS 1 and 2 are usually, follow up with a routine mammogram in a year. But if it's BI-RADS 3 or 4, they usually will typically ask us to, go forward with ultrasound. And then if it's definitely 4, we would send to biopsy at that point.
Okay. And the patient has a biopsy. Unfortunately, it does come back as breast cancer. What are the treatment options once that comes back as breast cancer?
So the treatment options also are very dependent on the stage of the cancer at the time of the diagnosis. But typical treatment options are usually surgical. That can range from a lumpectomy to a mastectomy, which is actual removal of the breast tissue on the one side or even both sides, depending. Plus or minus chemotherapy and radiation therapy.
Okay. Are there any oral medications that patients will sometimes use?
So yeah, there are some oral medications that they're called estrogen blockers. I mean, that's the generic term for them. But we will give that to some patients if they have a lower stage breast cancer. Sometimes lumpectomy plus estrogen blockers is sufficient treatment.
And are the breast cancer outcomes the same for all patients?
Yes. No, unfortunately, they're not. There are some patients that are higher risk based on the histological type of the breast cancer. Also, at the stage, again, at the time of diagnosis, will definitely tell us how their prognosis will be long term. Our best treatment is early detection. And then from there, if we do find something, going down the avenues that are written for us in the guidelines and the management practice.
So many of our patients, unfortunately, are uninsured or underinsured. Are there any opportunities for those patients to get screened?
Well, we actually do have an event on Saturday where we have free clinical breast exams for our patients, and it's actually going to be at the hospital. I think it's at Onslow actually. But what we'll do is we'll have those patients who are uninsured or underinsured over the age of 18. Me and other providers will come in and we'll do actual clinical breast exams and teach patients how to do the breast exams, teach patients what to look for when they're doing their own breast exams, and of course, if we find anything, refer them to appropriate screenings and testing.
Oh, that's great. So the event is going to be this Saturday. Do we have a time for that? It's 9 a.m. to 12 at Onslow Memorial Hospital. So that'll be an opportunity for the community to come out, get screened, make sure you wear your mask.
Absolutely, please.
And then, of course, if there are any findings, we'll provide the appropriate follow-up information for those patients. Any other final thoughts or words about breast cancer screening, prevention, treatment?
Again, I cannot, push this back home more, is that you just have to know yourself. And you have to trust that you are the expert on you. And so what I tell my patients, I don't live with you 24 hours a day, 7 days a week. So you know when something's not right. And it's important that you share that with your provider. And if you don't feel like your provider is not taking it seriously, then you got to keep pushing. You got to keep pushing. Because we do know that 1 in 7 women will be affected by breast cancer in their life. And so that's a lot of women. And so it's important to get tested as often as we can so that we can prevent these terrible outcomes that can happen from untreated.
Certainly. So I think I'll end the way that I started and just say, we spent a lot of time talking about COVID for good reason. But I think also we can't forget those other things that will creep up. And we know a lot of folks in our community, because of COVID, have put off a lot of that screening, a lot of those primary care, a lot of those normal prevention techniques, ideas, guidelines that we usually recommend. So we're really recommending that all women who fall within those guidelines really take seriously the idea of having prevention and screening mammograms. Because if you can catch the cancer early, then that gives you the best treatment option, certainly. Sophia, were there any questions online?
Nope, there are no questions today.
And before we leave too, I just want to put in a plug for Onslow Memorial Hospital. We'll be having their Pink is what it's called. So Pink Week, actually. So all next week we'll have all our folks dressing up in lots of pink, including some pink masks, having some raffles, and really having a renewed focus on breast cancer awareness and screening. So just wanted to put in a plug for that.
I'm already dressed.
Your stage is already there. I have to find my pink.
All right. Thank you both for being here with us, and thank you to all our viewers for watching with us. Have a great afternoon and stay safe.